GITRL target introduction. Therapies targeting the BAF pathway may offer potential benefits in treating these malignancies by reducing B cell survival and proliferation. TNFSF18, also known as GITRL, glucocorticoid-induced TNF receptor ligand, is a member of the tumor necrosis factor, TNF, superfamily. GITRL is a cytokine that plays an important role in immune regulation, particularly in modulating T cell responses and influencing the function of regulatory T cells, Tregs, and effector T cells. It is primarily recognized for its interaction with its receptor, GITR, glucocorticoid-induced TNF receptor, also known as TNFSF18, which is expressed on various immune cells. Structure of GITRL. GITRL is a type II transmembrane protein that can also be cleaved to form a soluble cytokine. It typically functions in a membrane-bound form but can also have effects in its soluble form. Extracellular domain contains the TNF homology domain, which is responsible for binding to the GITR receptor on immune cells. This domain facilitates the formation of homotrimers. Transmembrane domain anchors GITRL in the cell membrane, which is crucial for its role in cell-to-cell interactions. Clinical significance of GITRL. Enhancing anti-tumor immunity, targeting the GITR pathway has been explored as a strategy to enhance anti-tumor immune responses. Agonistic antibodies that activate GITR, thereby mimicking the effect of GITRL, can stimulate T cell activity and potentially improve the effectiveness of cancer immunotherapies. Combination therapies. GITR agonists are often studied in combination with other immunotherapies, such as checkpoint inhibitors, anti-PD-1/PD-L1, to enhance the overall anti-tumor immune response. Autoimmune diseases. Modulation of immune responses. Given its role in reducing Treg-mediated suppression, the GITR pathway could be a target for therapies aimed at modulating immune responses. Inflammatory diseases. Role in chronic inflammation. The GITR pathway's ability to amplify inflammatory responses suggests that it could be targeted in chronic inflammatory diseases. Therapies aimed at blocking GITR could help reduce excessive inflammation and prevent tissue damage in diseases such as rheumatoid arthritis or inflammatory bowel disease. Biomarker potential. Disease progression and treatment response. Expression levels of GITR or GITR in tissues or blood could serve as biomarkers for disease activity or treatment response, particularly in cancer. Alpha Lifetech can provide recombinant cynomolgus monkey TNFSF18 protein, histag, and other recombinant proteins. www.alpha-lifetech.com. info@alphalifitech.com